brings you guys in?
I had an accident like a year and a half ago.
Okay.
I fell and I hit my low back.
Okay.
And
How did you, like, what kind of fall? Like downstairs or?
Yeah, she stumbled.
Okay. So stumbled down the stairs a year and a half ago. What are you feeling?
I can do nothing. I can sit, I can walk,
Okay.
I can sneeze,
Okay.
I can laugh, I can do nothing because it hurts so much.
Okay.
It's like she pulls a nerve.
Okay. So anytime you like laughing or what, like it's hurting.
Yeah,
Okay.
and it's getting worse every day.
Okay.
Even when I'm sleeping, like I can't find a way to be in bed because it hurts. If I want to get up, if I want to lay down, if I want to turn, it's painful.
Jeez. Okay. And I can tell, well, you guys, like you said, just came from New York. Like literally just came from New York.
Yeah.
So, okay. Man, and it's everything. It's down. So now, what do you like? Is it pain, like a shooting pain, a dull pain, or what do you like? What kind of pain do you feel?
It's like here and
Okay.
it goes then here and
Okay.
goes to the knees,
Okay.
down the legs.
Okay.
Sometimes it's more painful here, other times it's more painful here.
Okay.
Other times it's just both legs.
Okay. Does it go all the way down to the feet
At night.
at night?
Yeah.
Okay. Any numbness or tingling?
Yes, I started feeling that this week
This-
when I was walking.
Okay.
Because I felt like I had to give like baby steps.
Okay.
Because my feet were like falling asleep.
Okay. Yep. All right. I see you have had chiropractic care before, about 6 months ago.
And I felt like
Really?
yes.
Okay. How was it, the care?
That was so painful. The guy made me cry so many times because he said the nerve here, he had to do something with that, and he made me scream touching that.
Did you get any relief?
I could move, but
Still in pain?
Yeah.
Okay.
And when I felt like everything just came back little by little, and now it's worse.
Okay. Let me have you stand up. And let me have you bend forward at the waist. As much as you can. As much as you can. And let me know what you feel.
Like a pull here.
Okay, come on. Alright, so you're feeling it start from here. Is it pulling like both sides right now?
No, just here.
Just the right?
Yeah.
Okay.
The hip, the first accident was in this side.
Okay.
And now it's coming to this side.
Okay. If you extend back like this, as much as you can, don't overdo it.
It hurts this side and this side.
Okay. What about if you lean in either side?
No, I don't.
No.
Yeah, that's
And then if you rotate,
it hurts here.
it hurts there? Okay. Let me have you lay face down on the table.
Oh.
Okay. And then I'll have you bring your hands down here for me.
Okay.
Good. Alright, so we're going to start off. We are going to scan the body from the cervical spine up here, checking the leg length. And I'm going to check the symmetry from the right side and that left side like that. I'm going to start off, I'm going to palpate, going all the way down. Let me know if anything is painful or tender. Okay, so now we're now we're getting to that pain. Yep, I can feel how you're tensing. Okay. Do you see that from there? Okay, so this left leg pulls short quite a bit. Now when we look at the hips, actually the hips look balanced. So the hips are looking balanced through here. What's starting to happen though is in that lumbar spine here, it's just pulling just a little bit. So this is what we're going to work on as well. We're going to start off, we're going to use that massage device, and I'm just going to relax things for you, okay? So we're going to start up top in the neck.
Okay.
Yeah, just relax right there, you're good.
Ow!
Take a deep breath in and out. Good. And we drop down a little bit lower here. One more time, deep breath in and out. Good. Okay. Let me have you sit up on the table.
Okay.
Bring one leg, like straddle the table, so one leg on either side. Good, yeah, it's just like that. Okay. Okay. I'm gonna have you bring one arm up and over. Bring the other arm up and over here for me. Good. Keep your thighs to the table. We're gonna rotate you this way. Good. Look over the shoulder. Okay, good. Good. And relax. Good. Okay. Got one more, just a little one here. There's more of that middle of the back. Good. Okay. Lay face down again for me. Okay. Still pull short. Okay, so we're going to stabilize on the sacrum. I want you to raise your right leg up as high as you can.
Okay.
Yep. Any pain with that?
No.
Alright, relax that side. Raise the left side for me. Pain with that side?
No.
Is one side, you can relax one. Was one side easier or harder to raise than the other?
I think this one is easier.
This one was easier? Okay, so I'm going to have you cross your right foot, yep, over the left foot. The table's going to come up from below you right here. We're going to uncross and we're going to bend that knee up. Good. Alright, raise that right side up again for me. How's that feeling?
It's way easier now.
Good.
Yeah.
Good, good, good. Alright, let me get you to flip over onto your back.
Okay.
Okay. Relax and let me have control of your legs here. Relax, relax, relax. Relax. There we go. Good. Come on now. You want to stand up for me? I'm going to have you turn and face that way. Good, good, good. Okay, bring your arms up like that. And I want you to bring your hands over my hands. Good. Okay. I'm going to lean you back just a little bit. Squeeze your elbows together. There we go. Okay. Take a seat right here, facing the wall that way. Good. Okay, we're going to bring one arm up and over, the other one up and over. Take a deep breath in, and exhale out. Good. There we go. And actually, let me bring your hair up there. Yep. And relax right there. Okay, you can let your hands rest on your stomach. Okay. Lift your head up for me. Okay, now we're gonna decompress the spine here.
Ah! Ah!
Deep breath in and out. Good. And deep breath in and out for me. Good. That was a powerful move, wasn't it?
Oh my god, yes it was. I still feel it on my legs. Oh, yeah.
Don't worry. Just breathe for me right now. What did you feel when I did that?
I don't know. I just felt that in my whole body, like all my bones.
Okay.
But it was a relief. But I have pain here.
Okay.
Okay.
Tell me. Let me have you sit up. I gotcha. Good. And relax right there. Just breathe. Get comfortable if you want to scoot forward a little bit.
Yeah.
How are things feeling?
It's good, but I feel like tension over here.
Okay.
And here.
Okay, so what I want to do, we're going to lay you back. I want to do one more Y strap. Things have just been compressed, and obviously with the falls.
Yeah, I know.
And yeah, that you guys came quite a distance out here. Yeah, let me get you to lay back again. So here, we'll put this, hold on. I'll put this over here so you can pull your hair through.
Okay.
There we go. Good, and now come back, I gotcha. Good. There we go. Okay, hold that just for 1 second. Thank you. Good. Good. And relax there. Breathe. Deep breath in and out. Now that time I went at, I know you probably noticed, I went down at a little bit lower of an angle. So the pull, that decompression I know was felt a little bit differently for you this time.
Yeah.
Good, but yeah, just relax. Yeah, you can tell how much she's been, well obviously you know. But yeah, and I know that low back, just how it's flaring up, that pressure when it catches on the nerve, and in her case for how long it's been going on for, has been, well, awful for her, obviously, which is why you guys came out here.
Yeah.
So.
It was better this time.
Good. That first time, the reason it's a little bit more rough is that there's more like scar tissue, more adhesions that I have to break through. So that second time is usually easier, especially easier on the body for you. So. Get comfortable. Good. How did that one feel? How are you starting to feel?
I don't know.
Some soreness, of course, but
It's like I had something heavy on me and it's gone. Like it's not there.
okay.
It's weird.
Okay. How's that low back?
I feel like something pulling.
Pulling in that right side?
Yeah.
Okay. We'll go through. Let me have you stand up first.
Yeah, it's here.
Okay, yeah, take it easy, take it easy. I just wanted to get you to stand, just kind of change position a bit.
So much here.
Yeah, we're going to get things to relax. Okay, very good. Alright, turn. Yeah. So it's all
Here.
okay. So I'm going to go through with this first. Is it right there, right where I'm on?
Yeah, it's right there.
So before, because what I'm going to have you guys do, I'm going to do a couple drops because I know what's going on there. It's a little bit more piriformis. Lay face down for me. What I'll have you guys do, after I do the next couple jobs, I'll have you guys go, if you can check in, drop your stuff off, and then come back. So it could be like an hour or 2 hours, and then I'm going to recheck everything on her.
Oh, thank you.
Just because she's got, well, obviously a lot of just pressure, and I just kind of want things to relax just a little bit. Like this leg.
Hey. Oh my God.
Yes. Bring your chest down to your legs. So come like this. Down.
I feel the pull.
Is that the pulling?
Yes.
Okay. And come on, come on. I'm going to have you do that a few times.
Okay.
So you know what's going on. Right where I was using that massager. So you're experiencing a very, very, very bad case of piriformis syndrome. Okay? So it's the muscle. And where it's connecting, because it was right when I pushed in, and that's the extreme pain. So the worst part about piriformis syndrome is what happens is that muscle, that piriformis muscle, wraps right over the sciatic nerve. And if that piriformis muscle is tight or spastic, it puts pressure on that nerve. And that's why you're getting those symptoms going down the leg as well. So again, go for drop forward. Good. Hold it, hold it, hold it, hold it, hold it. Okay, then come on. So I'm gonna have you do this a few times. Yes, I I know you're not gonna like me, but it's what you need.
No, I know. I know, and it's totally okay with me.
Okay. Come on down again. So this one, you're gonna have to monitor her. This is gonna be like the number one thing that she needs. It's gonna hurt, but
Yeah. If that's gonna
Yep.
disappear, I'll do it. I don't care. Yeah, I'm tired of that pain.
come on forward. I'm gonna bring you a little bit. Good. Hold it. Come on.
He's gonna enjoy it. Seeing me suffer.
Now, I'll tell you right now, you'll see there are different ways of stretching the piriformis. She can do like the same thing, laying on her back and bringing the leg. Yep. And then also when doing it like that, you can actually kind of put weight and put some pressure on the leg just to give it a little bit more of a stretch, you know what I mean?
Yeah.
Stay right there.
I hurt so much.
I know, because that one you're doing that stretch and with that pulsation with the massage device. I know that's we're gonna relax at that like that. That's a rough one, I know. I told you I'm putting you through a lot today, but you guys did come from New York, so and this is something that you need worked out. Let me have you lay face down again for me. Okay. Looking better. Right's a little short. Right hip's a little high. So those are the main things. Now granted, it's that lower. How are things feeling in here?
Yeah, way better.
Oh, way better. Good.
Yeah,
In here?
it's fine there.
Good. So now in the neck, do you have more pressure on one side than the other?
Yeah, I think this one
So in here?
is hard one.
In here? Not as much?
Horseburn. Oh.
Okay. So what I want you to do,
Uh-huh.
I am going to have you lay on your side, but facing me this way. I will show you what I'm going to be doing. So I want your head to be in here. So your shoulder, yep, is going to be just before. So no hand there.
Okay.
Good. And all the way on your side. I'm going to bend these knees a little bit more. Good. Good. Let me see, I think we're up a little too high. Yeah. There we go. Yeah, pressure when I push in here.
No.
Okay. So, actually, let me get you to scoot up on the table just a little bit.
Okay.
So come up, like go up just a little bit. No, like that way.
Okay.
Yes, that's perfect. Okay.
Yeah, Harster.
Right there?
Mm-hmm.
Okay. Good. And relax. How's that feel? Good. Okay, let me have you sit up. Whichever way is easiest. And relax. How does that feel now?
Yeah. Yeah.
So what happened with that top bone It's called your atlas, and actually I will show you. So this is your atlas bone. Now the way that this bone goes out of alignment, because it's such an awkward bone, but the way that this one goes out of alignment is it will normally slide to the left, to the right, and it can kind of go up a little bit, but it slides on the top. So what happened is that you were feeling that little bit of stiffness because that Y strap, obviously, you had it done twice.
Mm-hmm. Yes.
When it decompresses, it pulls. It's a very aggressive move. Every now and then, sometimes that atlas goes a little out of alignment, and so it's just a little bit to the left. So when we had you lay down, we did what's called a toggle adjustment, and so when you toggle, you're toggling that atlas, and all I was doing was just pushing it from left to right. But as you can tell, that little bit in the neck is feeling
Yes, I move my neck again.
good. So every now and then, some things need to be changed up just a little bit, but good with that. Stand up for me. So I know you're gonna, I just want to see range of motion. Kind of, lean into the sides.
Yes.
What?
I can't move. Yeah, because I couldn't do this. No. In a long time, I think. So now I can dance.
Good. Come back a little bit for me. Good. Come forward a little bit for me. So, as you guys can see, it was as simple as, that one bone up top, and people don't realize that one bone up top can affect even down low. Now, granted, I know you still do have that pull like that with the the piriformis syndrome, and so it's pulling. So that I do want you to keep on her with stretching and kind of help her with that one. I'll even show you before you leave some of the videos. So I do want him to go over those stretching and do that with you because that will help clear that up completely.
How many times a day?
Twice a day, in the morning and the evening.
Okay.
So you either kind of give yourself a few minutes, right when you wake up, and then right before you go to bed, and that will. If you need to do anything on your own, you can, as you're sitting in a chair, you can kind of do that stretch. You don't have to have him there with you, but it would be better with you on those ones. But yes, so we went through that entire adjustment and even that. And there's a lot of doctors even out there that this is the only bone that they do adjust, that atlas, just because it's such a powerful adjustment. And at times, when people need it, trust me.
Yeah, I need it.
Yeah, because you can tell just by the look on your face, just kind of you're not. Yes, tensed up and holding stress. So, perfect.
Thank you so much.
You're welcome.